making some drops for her. Everything. Yeah. Thank you.
Hello. Hello. We're getting ready for my LASIK surgery. And I'm pretty excited about this. It just gave me some drops, but I think I'm getting more. Am I getting more?
A lot more.
A lot more. Drops are good. So you should show Kristen. She's the digital operating assistant.
Yeah, thank you.
You can actually tie my hair. Got my cute outfit on today with my. So tweet me. Use the hashtag live surgery is the hashtag for this.
And tweet.
Oh, and Dr. J Schwartz, his Twitter handle is at Dr. J, J-A-Y, Schwartz, S-C-H-W-A-R-T-Z.
And Amy, you want Valium today, don't you?
I do want some Valium. But
Good.
sister up, I guess. Why not? It's gonna be interesting. So no makeup and Valium. This should be fun.
I'm going over all that with you too, your makeup.
I put it to
Brandy?
the side. Yes.
Valium key?
Can you turn it around?
Okay, you get one more thing here. Have you put these right here? Get through there. Right there, just like that.
That's the main key.
Thanks.
Drops.
Thank you. I don't know. Okay, I'm going to have you close your eyes for about 20 seconds. Before we put any drops in them. Good job.
Everybody's telling me goodbye. Thank you. Leah Hardesty said she's afraid to watch. She's my friend from 6th grade who's worn glasses all her life. I think you should watch, Leah. I don't know if you're watching, but. Oh, and I have another. Everybody's watching. So at KA238 will be taking over my Twitter handle, and at Dr. J Schwartz will also have an assistant guest tweeting for him today, but he will be talking everyone through the procedure. And
Let's start
that's all.
by putting some antibiotic drops in your eye, okay?
Okay.
Why don't you look up? Now, for putting drops in your eye, when you get home, so let somebody help you with that. Best way to do it is hold on your lower eyelid like that. So I'm going to pull down from you. And you just put a drop right in the top, and you blink, it goes all over. So the other eye now. Like I said, these are just antibiotic drops. So, now, we're going to go over some rules.
Okay.
Okay? For the first 2 weeks, no swimming pools, hot tub, jacuzzis, whirlpools, or saunas.
Okay.
For the first week, no makeup or lotion around the eyes.
Really?
No strenuous activity, no heavy lifting over 40 pounds.
Ready?
You can, but lightly, don't sweat.
Okay.
In case you need a lot. For the first week also, when you're taking a shower, just don't have the pressure of the shower head hitting the eyes.
Okay.
Okay? Wash your hair, close your eyes, let it all run down. Also, for the first 2 weeks, no rubbing your eyes whatsoever.
Okay.
Leave the sleep out, you know, when
Body.
you're taking, yeah, but no rubbing back and forth.
Okay.
Since you're going to be taking Valium today, no driving, no operating heavy machinery today, no major decision making today.
No jet
okay?
skiing.
Yeah, I wouldn't do that either. That would be a good one.
No major decision
I went
making.
jet skiing after I got my wisdom teeth,
All fun.
but I won't do that.
Now, when you come out of surgery, or I should say, let's walk you through the surgery. When we bring you in there, we're going to lay you down. We're going to put a patch over your left eye. How we create the flap at first is Dr. Schwartz is going to apply a suction ring to your eye. You're going to feel pressure on the eye a little bit.
Mm-hmm.
We're going to slide you underneath the inner lights. A little cone comes down and applies a little bit more pressure for about 13 to 20 seconds. We just want you to stay still. Sometimes that suction ring can slip off. Don't worry if it does. We'll just slide you back out, put it back on, reapply it, and bring you back under.
Okay.
We'll create both flaps the same way. After your flaps are created, we're going to slide you underneath the laser. Dr. Schwartz is going to put a speculum in the eye to keep the eye open. Might feel a little bit weird just keeping it open the whole time. We'll have a patch over this eye. When the laser is firing, they'll have you looking up at a red light. You may smell a hint of burning, like hair being burned, skin being burned. Don't let that phase you out at all. Okay? Just normal smell it gives off when the cornea is reshaping. Also, a lot of people worry about is, what if my eye's twitching and moving around while the laser's going on around?
Right.
It follows your eyeball movement, so don't worry about that. If you go too far out of the tracking area, it will shut down. Dr. Schwartz will reposition until you look back up. Once the laser goes off, you'll put the flap back down. It's already starting to heal in place. We'll proceed with the left eye. Once both eyes are done, we're going to get you up. We're going to bring you out in the hallway here in front of the slit lamp. He's going to look under to make sure the flap lines are where they're supposed to be positioned, where they were before we started. We'll bring you over here. I'm going to take all your garb off you, take your blood pressure, and I'm going to give you a take-home kit to take home. Inside the kit, you're going to have some sunglasses I'm going to put on you. Okay? You're going to be a little bit light sensitive. On the way home, try to keep your eyes shut a little bit, okay?
Okay.
It's going to help immensely for you. Also, we've got some re-wetting drops to get you started too. We'll give you more of these. You're going to want to apply these, and I'll go over all the drops with you in a second.
Okay.
If you forget any of the instructions I'm going to be telling you, we have instructions in here as well.
Okay.
Okay? There is some surgical tape in here, as well as some shields. You're going to wear these to bed for the first week whenever you're sleeping. Just in case you wake up groggy, you might rub your eyes. We don't want you rubbing your eyes. You see where the little notches are on the ends there?
Mm-hmm.
Point those towards your ear. So go ahead and put them on there once. You'll put them on like this. And what you're going to do is put a big X over each one to keep them applied. Okay? And then when you get up in the morning, just take them off. It's just when you're sleeping. Okay? That's all we want you to use them for. Now, your drops. You're going to be doing a lot of drops. We're going to give you Zymaxin, which is an antibiotic drop, and Predforte, which is an anti-inflammatory.
Okay.
You're going to be taking these 2 drops 4 times a day for the first week. Breakfast, lunch, dinner, bedtime. Whenever you're taking more than 1 drop at a time, give it 5 minutes between drops. Put a drop in each eye, wait 5 minutes before you put the other bottle in. Okay? You're going to, when you get home today, you're going to take these. Put a drop in each eye, wait 5 minutes, put a drop in the other bottle. Put your shields on. Take the Tylenol PM I have in your packet. Go to sleep 4 to 6 hours. You're going to feel stinging, discomfort, graininess, burning. If you're sleeping, you're not going to feel anything. You wake up after 4 to 6 hours, no discomfort. As soon as surgery's over, you're going to go, oh, it's a little bit clear, but it's going to look a little bit hazy, like you're looking through a fish tank. Once you wake up after 4 to 6 hours, you should be nice and clear. Now, we're going to also give you Restasis and re-wetting drops. The re-wetting drops, they're always preservative-free for the first month. You're going to put these in your eyes every hour on the hour that you're awake.
Okay.
Okay?
For how long?
For right now, we want to do it for the first month, every hour.
Wow.
If you want to do it every 5 to 10 minutes, go ahead. You can't overdo it.
Okay.
We just don't want you going beyond an hour. We want those flaps to stay moist so they heal properly.
Okay.
Okay? Restasis is another drop we're going to be giving you. It's a cloudy drop. It helps combat dryness of the eye. You're going to be taking this starting tomorrow. You'll start these tomorrow in the morning and at night before you go to bed, twice a day. So you'll be taking, when you go to bed, 3 drops. So 5 minutes apart. Put a drop in, wait 5 minutes, put a drop in, wait 5 minutes, put a drop in, and go to sleep. Put your shields on.
Okay.
Okay, and like I said, if you forgot anything I'm telling you, the instructions are in there. If somebody's with you too, they can read them over, make sure you're doing the drops correct.
Okay.
Okay? We're going to give you all this to go home with. Now, you get to sign right here that I gave you instructions, and you've met Dr. Schwartz too. And I will give you a pen. There we go.
Have we delivered to your life? Yes, very much.
See how I have you signing before you've had your value?
Yes, that's smart.
Okay. I want you to do, I'm gonna open this part way, and you're gonna open it the rest of the way.
Oh, this is the value?
Yep, hold that in.
Oh, jeez.
There you go. And here.
So a little guy. Or just take it, right?
Yes.
Value. I don't know that I've ever had that before.
It's just at 5 milligrams. It's not that strong. Go ahead and drink that for me. Dump that right here. And put another drop in, like I said.
Oh.
Pull down, yeah. Kind of like skeet shooting. I'll just tell you to pull, okay? There you go. Still, your blink's good. You can just blot if you want to there.
Can I wear my my glasses as long as I want?
Oh, you mean the granny style glasses? Yes. But you know what you want to do though, after surgery? Pick up some glasses, make sure they're polarized. Polarized, they're going to stop the glare down. They're going to save your eyes so much from overuse.
Okay.
They'll keep the darkness out
Shopping.
for you.
So
But
basically I'm going
polarized.
shopping tomorrow.
Yeah, you can do that too.
But probably not today. Do you think after the 4 to 6 hours of sleeping,
You can do whatever you want.
really?
Yeah, just not, like I said, just the restrictions. For the first week, no strenuous activity, no heavy lifting over 40 pounds.
So we
And
have
you
a
get to
big,
keep the makeup off too for the first week and lotion around the eyes.
we have a big virtual happy birthday party for Shaquille O'Neal on Sunday. It's
You'll
his
be
birthday.
fine. You will be fine.
Okay, good. Make
You
sure
will be
I'm ready
fine
for
for
that.
that, I
I might wear
promise
my
you that.
glasses.
Okay,
So
let's
if
put
you're
another
watching-
drop in. Pull.
If you're watching right now, please use the hashtag live surgery and let us know what you think. So if you're considering LASIK, I'm about to show you what happens. So far, so good. These guys are the best. Dr. J did Grant Hill's LASIK surgery. He has done many other athletes. Worked with Amari Stoudemire when he had his eye challenges.
I'm putting these in for you. This is the blink. Okay, the difference between the blink and the restasis, which is in this box here, see the cloudiness?
Mm-hmm.
The blink is clear liquid. It's just an artificial tear. That's what's in here. These things.
Okay.
Okay. I've got the Zymaxid and the Pred Forte you're taking right in here. I'm gonna have I'm gonna send you home with 2 bags. Okay.
Okay.
Put these there.
And we're videoing all this so I can look back.
There you go.
Forgot,
Hey,
'cause
there
I
you
don't
go.
remember.
I try to do that
a
every
lot
night
of
too.
Drops.
And I'm going to put another antibiotic drop. Go ahead, lean back. Tip your head back just a little bit. It would make it easier when the person puts it in. Again, kind of put it like they did. There you go.
Lots of drops.
I get dressed up too.
Hi, Amanda Miller. I think I might have to retire my phone soon. I'm waiting for that
Okay, you got it.
directive. iPhone 4. Did you see the new iPad is?
The iPad 2?
Mhm.
Yeah, I saw that.
You getting one?
I don't know yet. I drop my phones a lot.
You do?
I got one of those covers.
I drop mine a lot, but they're pretty
Oh,
resilient.
I think the phone manufacturers love us for dropping.
Am I nervous, Andrew? I'm not actually very nervous. I went skydiving last week, and I was less nervous than this, though. So that tells you. You're a little nervous.
Okay. One more here. Pull back. Lean all the way back. Pull. Good. Excellent. This is the last antibiotic drops I'm going to do. And then I'm going to put numbing drops in like we did in the room earlier.
Oh, okay.
Kind of numb your eyes down for you.
Thanks, Elizabeth. I'll see you soon. Yeah, the no makeup and Valium is what I'm most worried about.
Okay. Pull.
So you just put numbing drops in my eye.
Does that sting a little bit?
No. Should it?
No, because it normally should, but we put numbing drops in earlier, which stung at first. Remember that? When I first
Yes,
put
I remember that. Actually, it didn't feel bad. I'm searching for the link as I tweet. Okay.
About to go out.
Thank you for your support, everyone.
Be right
You
back, one
guys
second.
rock. Steve has his popcorn ready. I'm glad I could be your entertainment, your Friday entertainment. Thank you, Davin, for your compliment on my blue gown. Yes, I did wear my ASU Sun Devils shirt today. Go Devils. Hopefully Sparky is watching. If someone could tweet him at Sparky Arizona ST, let him know. Hi, Leah. You need to come and see Dr. J, Leah. I think that you would be surprised
Okay.
at all this stuff.
I need you a second. I want to recheck one thing on you before we start. Come on with me, and we'll be right back. You leave your stuff there.
I'll be right back.
Do you want to dance for us?
No. Hi.
How are you?
Good, how are you?
You all ready?
Yes, yes. Great.
Yeah.
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 Yeah, we're ready for that. Everybody's watching. We were out streaming.
Yep. Right.
Good, good. Good have a seat.
Thanks.
Dr. J.
Good job.
Thank
We're
you.
just making sure that it's clear what we're going to have for the prescription. We just wanted to check it out with you before we do that. Have it in the
Sweet.
paper.
Double checking. Awesome.
And I'm going to put one more numb and drop in. Go ahead and look that. Excellent.
So, see Dana White's tweeting. We should tell him what's up. So, it's about 15 minutes or 10 minutes total. It's 5 and 5.
No, it's going to take about 10 minutes, so yeah.
Oh, someone wants to know what would happen if I were to accidentally sneeze.
I'd say, God bless you.
Okay, we'll be
You'll
okay.
fine. Yes.
The laser wouldn't like
Yeah. No,
cheater
never.
or
I've been
anything.
doing this thousands of times. Never seen anybody do it yet. They kind of say I'm going to sneeze, and then we can just. Dr. Schwartz takes his foot off the pedal and just sneeze if you need.
There's a pedal?
That-
He has his foot on the pedal?
Yeah, that runs.
Oh.
So that turns. Yep. So he has total control over what's going on.
It's kind of like a piano.
And there's a bit.ly if people want to watch bit.ly/live LASIK.
Oh, okay, so there's a bit.ly too, if
Oh.
you haven't found the link. So it's
What do you want? I got it.
bit.ly/live LASIK. And the hashtag is live surgery. Dr. J Schwartz is at Dr. J Schwartz, and we've been talking about him at Digital Royalty on my Twitter feed as well, so you can find him. So Dr. J, if you're just tuning in, I'm about to get surgery, live LASIK surgery. I've taken my Valium, I have no makeup on, I have numbing eye drops in my eyes right now. I'm still tweeting. And but Dr. J is the team eye doctor for the Phoenix Suns the Coyotes and the Arizona Diamondbacks. He has done a lot of professional athletes' eyes, and he's the best. So I'm pretty excited about this. I have, over the last several years, have had a hard time seeing at night, especially driving, anytime driving, and seeing scoreboards, the field, the octagon, you name it. So that's an issue. And I'm not a big fan of my glasses. In fact, my glasses are going to be retired soon. So maybe I'll donate them. Little cute glasses. And I get these ones for a few days. So get that going for me. And there's Dr. J right here.
Well, hello.
So are you ready?
Ready?
I was just telling everybody about you.
Oh,
And
thank you.
Grant was tweeting me yesterday.
Oh, that's nice.
He had great things to say. So I should put my phone down now.
Yeah, we're ready to move.
1 second, I want you right here. I want you to close your eyes for a second. Keep them closed. You got Kleenex in your hand?
No.
Nothing in your hand but your pillows?
I don't.
Good. Stay right there for no.
Did
Stay there for 10 seconds.
Me talk with it first, or did you want me to go in?
We can wherever you prefer. Just give us a little rundown of what's going to happen, and then you're going to do play by play and stuff.
Okay, they're not quite ready in there, so.
Tell you what, I'm gonna have you sit right here. There you go. Keep your Kleenex away. I don't want you touching your eyes again, okay?
Okay.
First thing I want to do is have you
You have
change
gum.
the picture on the site. So that's about 50 pounds ago.
I know. Can I open my eyes or not so much?
Yes, you can. You
Okay.
can open them now.
Dr. J, you've been running, right?
Yes.
So you've been running
Yes.
and working
Training
up
for a marathon.
toward a marathon.
Yes. Hopefully going to the OC Marathon May 1st. We'll see. Otherwise, San Diego in June. I'm deciding in a couple weeks which way to go.
Very cool.
So we'll see how I hold out.
Exciting. Enjoying. So
You're doing that.
I've done one marathon, one full, and then a few halves, but it's awesome. I mean, you've been training for a while, and
Yeah.
you're up there. You've done, what, 22 miles?
18.
18.
That's when I had a problem, but then Aaron Nelson and trainers helped me out, and I'm back running again. So
They're amazing.
unbelievable, absolutely unbelievable. They diagnosed it in 5 minutes. Within 2 weeks, I was running, and I haven't had a problem since. So
That's cool. So Aaron Nelson's at the Phoenix Suns, and he is taking care of Grant Hill. He took care of Shaquille. He looks after Steve Nash, of course.
yeah, he's
Keeps
brilliant.
them healthy. Yes.
And their whole team is great.
Absolutely.
So they're getting us ready in there. So
Okay.
right now, I can answer any last minute questions that you might have. If you want to kind of walk you through what's going to happen, I can do that too.
Yeah, maybe just one picture.
Okay. What we're going to do first, bring you in there. They'll get you positioned, and the first step is going to be creating the flap, and that's using the intralace to do that. That procedure is done on both eyes, one at a time, and then I bring you over to the actual laser where the reshaping of your cornea is going to take place, and that's going to be the Vizx with the custody. And we'll do the right eye, and then we'll do the left eye. The whole thing should take about 5 to 8 minutes.
Okay.
It's pretty quick. And it won't hurt.
Someone asked, what if I sneeze?
I'll say God bless you.
Exactly. Now, so how long have you been performing LASIK?
I started doing LASIK in late 96, late 97, early 98. Yeah, I'm not that old yet.
How
So,
many procedures total have you
Just under 34,000.
done? 34,000.
Yeah.
Okay.
I mean, I was literally checking because we're doing this on like 33,995 or something like that. I mean, right there, almost 34,000.
Right, and you have your crosslink. Will you talk just for a second about your new technology or the new
Crosslinking?
procedure?
Well, yeah, I mean, as you know, not everybody's a candidate for LASIK, and not everybody can have laser done to their eyes. So, cross-linking is something for patients with keratoconus, patients who've had previous surgeries like RK, where they're having problems in their corneas. The cross-linking will stabilize the cornea and harden the cornea and allow for them to really have a much better prognosis as far as their deteriorating vision. It'll stop it in its tracks. What we're actually finding is that many patients are getting better vision from it, but that's not the goal. The goal is simply to stop these diseases that can attack the counties. It's investigational right now. It's only 13 centers in the country. We're very fortunate to have it here.
One of 13 in the country. That's pretty good.
Yeah, it's amazing. The results through the first part of the trials have been incredible. Absolutely perfect.
And I've had a lot of people responding through social media saying, oh, that they didn't think that they're a candidate for LASIK, so this might be something that you look into if you aren't necessarily a candidate.
Well, yeah, I mean, not everybody is a candidate for LASIK, and those that aren't, sometimes the ICL and implantable contact lens is a better choice. Sometimes it's PRK, where we do the same laser, but we don't do the first part with the flap. But some patients aren't a candidate for anything until they have their cornea fixed because they have a disease. And a certain percentage of people out there, and a very high percentage of patients that seek care for their eyes, for LASIK, do have something wrong with them that's medically treated now with this cross-linking. So it's incredible.
Leah Hardesty, I think that might be something you look into. Anyway, there's specific for that.
Gotcha.
You guys ready?
Ready?
You want to wear your put your sweater on?
Yeah, I think I'll be cool.
Yeah.
Ready? Thank you. Thank you, Bird.
Come on this way. Set right down. Put your head and put your pillow down there. Like that. Gonna bend your knees, let me know. We'll try to keep it nice and still, whatever you feel comfortable with,
I
okay?
think I got
Don't forget to use the hashtag live surgery. Tweet at Dr. J. Schwartz.
Totally think it's an angry bird.
You are?
Totally. I saw that in your hand there. I'm like, I know what that is.
I met the Angry Bird guys at the Mashable conference, and they gave this to me, and I didn't know what I would do with it, and here I am.
It's very cool. I like that game. I got my kids playing it. It's fun.
Dana White was playing it. We had a long flight, and he's an Angry Birds player.
Cool. Okay, now, go ahead and put the suction on your eye. And I can tell you as much or as little about this as it happens.
Probably as much as everybody can hear.
That's fine. But sometimes it makes people a little nervous. They like to just get it over with. What I'm going to do here is I'm going to try to open your other eye out. Here. The thing about this is all standard equipment, but eyes are slightly different sizes. Right here. Pull them over that way. That's normal. It may go dark. If it does, that's fine.
So just stay still, right?
Exactly. I'm going to raise you up a little bit. Stay still and most of all, don't worry. Just get your mind back here. You may feel a little bit more pressure. Excellent. Now, go ahead when you're ready, Brian. Just hold very still.
13 seconds remaining.
Excellent. Doing great. Don't move the muscle. That's being created as you speak. Doing real well. Hold still. Very nice. First flap is done. First part is usually the tape. Stick it where you're choosing. Okay. Now, if you're okay, we're going to start the other eye.
Okay.
That's the
Okay. Same kind of thing. Squeeze that suction in here. You can try to relax your other eye as much as you can. There you go. Good. Suction. Same thing. right?
Yep, is everybody using the hashtag?
Lift your chin forward. You're fine. Go ahead and just pull that one. On the monitor, we can see a little fiber on the comb that's used to create the flap. So we just took that off to have some sterile air blowing across it to make sure it's clean. That's all. Usually they're just fibers from like the drapes and things that are already sterile. It's not an issue, but just to be safe, they always make sure. That's fine. Just hold very still on that line.
13 seconds remaining.
Don't move now. Hold very still. That's it. Don't move, don't move, don't move. Don't move. Great job. You can see on the support thing. Just don't move. Now, the rest of it, you can move a little bit. Because the tracking system on this laser is amazing. It'll follow you until it can't anymore, and then it'll just stop. So if you move too much, it'll shut off. But still prefer if you don't.
So I talked to Jeremy yesterday.
Oh, yeah? Quite a while ago now. We're treating years ago, right? So
Yeah.
We're treating Amy Martin today. We're treating both eyes. Amy's right eye is minus 0.66 plus 0.26 at 33 with an adjustment of minus 0.10.
pinch a little bit.
Acts are 529 and 528.
Scoot down towards your feet about an inch or two. That's fine. Do is marking on your cornea, right over the surface of the flap. The reason I did that is in the early days of LASIK, when a flap was made using a blade, sometimes the flap would get cut off, and you have to be able to realign it. Nowadays, it's done just so that we make sure the lining up with the flap is perfect. But most of those issues that we used to have with blades are no longer an issue anymore because of the injuries. It's such a better way to create a flap. It actually amazes me there's still doctors using blades out there. Take a quick measurement, see
409,
how we got
415,
the flap.
409.
Okay.
Track is on. Registering.
Good job now. Straight at that light string.
Overhead.
The laser does make your dilate a little bit to track, just to be able to see it.
Okay.
That's why we have to turn the lights down. And I can see on the monitor your pupils got a little bigger and it should register easier that way.
I think I could watch a movie later. Or not so much.
You mean tonight?
Yeah.
Yeah, I would say you want to wait about 4 or 5 hours.
Right, right. Okay.
What movie?
Well, I was gonna say deeper, but I probably don't want to go to the theater, right? The deeper movie?
Well, that brings up two things. No, I'm sure that would probably be okay actually if you wanted to go, as long as it was after about 4 or 5 hours, you'd be fine. I think we're gonna go to Louis tonight. I want horses. Sitting that David movie.
Adjustment bureau?
Yeah, that's it. We're going tomorrow, I think.
Four seconds remaining. Treatment on the right eye is complete.
A little bit of water on your eye here. Actually, now it's all solution.
That is great.
It's pretty quick, huh?
Oh, this is what it is now, and this is the delay.
We'll be treating Amy's left eye today. The left eye is minus 0.49 plus 0.28, that's 147 with an adjustment minus 0.28.
Honor. One down.
One down, one to go. Got speculum this side, so we'll go back. Here is not to squeeze your other eye, because that one's just been done. You don't want to make what that black You can blink it as much as you want, just don't squeeze it. Lift your chin.
Oh, I have to sneeze.
Okay.
Kidding.
Straight at that blinking light.
Zoom a little. Can you zoom anymore?
Straight at that. Looking down, just looking off the flap. Checking all the things again. Make sure we are where we thought we were.
417, 430, 421, 426. Track is on. Registering. Verified for 6 seconds.
Straight ahead. Raise your eye.
Treatment is complete.
Water.
I had a dream that like that's done with the great man.
Really?
It's a really weird dream. I'm really glad they did it.
Yeah, you're like what? First year residents or second year residents now or something?
Yeah. And they're not mine.
Yeah. They think they can do everything, I'm sure. These on the shows.
They were drama in the dream.
It's good. Everything looks great. Take this out. We're gonna take a look at you at the microscope in just a couple minutes.
Sweet, I'm done.
You're done.
My eyes open or shut?
What's your shot? You can open them.
Good job. Great.
Get up here. That's it. That's so cool. I'm gonna step off to one side here. Right handle just stepping off. You're right off the
So
store.
you know how long ago?
Thank you.
So he's just gonna check the blood pressure and that's it.
Okay,
Can we carry that for you?
so we have her say goodbye.
I got it for you.
Yeah.
Go ahead.
I'll follow you.
Camera ready. Okay, okay. Awesome. No pain. I highly recommend you just come see that today.
All the way forward. There you go. Perfect. Looks great.
Jump high five. Thank you.
My pleasure.
That was pretty simple. So you've seen it.
Come on this way.
Basically.
Watch your step.
Have you sit right down here. Take that. Keep these on the car. One thing here. Okay, I want you to cross your legs and keep your blood pressure. Just sit up nice. Pull that back just a little bit. There we go. Yeah, no cross. Sit still. Now, when you get home today, I want you to put your tears in. Zymax, which is the antibiotic drug, Red Forte. Take the Tylenol, PMS, and the kit.
Someone else listening to this too.
Yeah, put your shields on. Go to sleep 4 to 6 hours. When you wake up, start doing your drops. All the instructions
So just in time for Ellen.
Yes, there you go.
Okay, so wedding drops, antibiotic.
Not wedding drops, antibiotic drops. The Pred Forte, Zymax and Pred Forte. Shields, Tylenol, go to sleep.
Okay.
Sleep. The best thing for you.
How's my blood pressure? Thank you.
And I've got your things in, I've got 2 kits here for you, okay?
Okay. Oh.
There you go, 105 to 69. That's good.
Anything you want me to tweet to your colleagues?
And I want to take these off.
I mean, I don't know. There's so much fear. It seems like a lot of people were nervous and scared, but how easy was that? I mean, you guys saw it. Able to have a full conversation in the middle of it. It's pretty cool. So,
Okay. Get you up.
Jay rocks.
Hold that. And here, these are for the ride home in case you need some. In case you're hurting a little bit. Here's your tweezers.
So we're done. So I think we're wrapping up. That is almost like a walk in the park.
Everybody still has time to go get lunch here. It's 12:10.
Can you do that?
Yeah, I can actually. I have my cool shades too.
Sorry.
Well, thank you so much.
You're welcome.
And
We'll see ya tomorrow.
yeah, so follow the picture tomorrow. Cool.
There you go.
Thank you guys, everybody, for watching.
Maybe sit home.
Okay.